Welcome to Vital Voices, where we connect you with expert insights to empower your health and well-being. I'm your host, Alexis Burrows, and today we're diving into the cornerstone of healthcare, primary care. Joining us is Dr. Reonda Evans-Pinder, a dedicated primary care physician, here to share her expertise on how primary care serves as a foundation for health and wellness across every stage of life, from newborns to seniors. Together, we'll explore how the role of primary care evolves throughout life, why it's so vital to long-term health, and how it impacts the overall healthcare journey. So whether you're a parent, a young adult, or caring for an elderly loved one, this episode will shed light on how primary care can guide, support, and empower you. So let's get started. Today's episode of the Vital Voices podcast is brought to you in part by Oak Tree Medical Center, Colina Insurance Limited, Vala Security Limited, Crown Locksmith Services, Tranquilitas Day Spa, and Jan RG Nation. Listen up. Vital Voices podcast has an amazing giveaway just for you. Want to treat yourself to the ultimate relaxation? Subscribe to the Vital Voices podcast on YouTube between January 20th and January 31st, 2025, and you will automatically be entered into a raffle to win an 80-minute deep tissue massage courtesy of Tranquilitas Day Spa. Imagine melting away stress and tension with this luxurious experience. It could be yours for free. Don't miss out. Subscribe today and tune into our show on February 3rd to see if you're the lucky winner. Relaxation is just a click away. Subscribe now and good luck. So welcome to the show, Dr. Evans-Pinder.
Thank you for having me, Alexis.
We are excited to dive into this conversation. I've been doing podcasts in the medical space for a number of years now, and one of the things that has continued to pop up in conversation is the importance of the role of the critical nature of primary care. So I'm excited to kind of sit down and talk with you about, from an expert who works in the field, who works in primary care, to get your insights on this topic. You see people talk about it from the financial aspect of medicine and how it plays a role, from obviously people's health and how they manage it, being able to, have early interventions, things like that, and just kind of the different aspects of healthcare that primary care plays in. So, let's, take a step back and start at kind of the ground floor. What is a primary care physician? What role do you play? And how does it differ from other specialists within the healthcare system?
Okay, so as a primary care provider, I am the front line.
Mm-hmm.
I am one of the first persons that patients will interact with.
Mm-hmm.
I will help every member of the family, so all age groups are affected by the work that I do.
Mm-hmm.
Typically, we are general physicians, which means we have general knowledge of all areas and all systems.
Mm-hmm.
We provide care for wellness in terms of maintaining wellness, empowering you to improve your wellness,
Mm-hmm.
Screening and prevention. We also manage acute illness. So if you do get ill, we do treat you and we can make referrals to specialists as necessary,
Mm-hmm.
as well as we help you with just your day-to-day living.
Right.
We are the bridge between your acute illness and wellness,
Mm-hmm.
as well as for specialty care.
Okay. So it really sits at the nexus of health, because from what you're saying, it seems like someone comes into you, if there's a need for specialists, you have the ability to redirect them or refer them.
Correct.
If there's a need for catastrophic care, you have the opportunity to redirect them accordingly. But then you also sit in the space of being able to manage chronic illnesses and things like that as well.
Correct.
Okay.
So we are essentially partners, educators for the patient,
Mm-hmm.
advocates for them, and we navigate them through every phase of their life.
Yeah.
Whereas when they go to specialty care, they're going to somebody with advanced knowledge of a specific system,
Mm-hmm.
and they're going to get care at that point of service.
Okay.
And we liaise with those persons. So we're technically a bridge
Mm-hmm.
between both services.
I like that. The bridge between the different aspects of service. So why then is having a primary care physician important for maintaining overall health and wellness?
So having a primary care physician is very important for health and wellness.
Mm-hmm.
So health is not just the absence of disease, but it's improving your overall wellness and empowering you to actually optimize your health,
Mm-hmm.
so that you're not just surviving day to day, but you are thriving. And I'm talking about the whole individual, mind, body, and spirit.
Mm-hmm.
So it is important to start off with a primary care provider, and we are the person that you will build that relationship with for many years. We will have that trust. We are the
Mm-hmm.
person that you can come to if you don't understand something from your specialist, or even if you read something or heard something, you can come to us from the beginning to the end, and we have the time to invest into the management of your conditions or the lack thereof.
Right. I know one of the things that, in talking with specialists, one of the reasons why they always like to encourage people to have a primary care physician is because, and you alluded to a little bit, that idea of building a rapport and a relationship, because in a lot of instances, your primary care physician should essentially be your lifelong physician.
Correct.
Regardless of the way you put it, any acute or other things that may pop up in your life, that person is kind of the core. And so I know from having conversations with other specialties, they always say, well, it helps them because if that person has a primary care physician, all of their history, all of what they've gone through, what they've experienced is then, able to be passed on to the specialist to help them kind of decipher through and have a better understanding of what that patient is dealing with, rather than someone who may just roll in off of the street, who's never had a primary care physician, only goes to the doctor when they're sick, and it's kind of like you're starting from scratch. And so I know that's a part of the conversation that's happened around that as well.
Correct.
So you mentioned, and obviously we talked about it in the open, that, primary care runs from as young as newborns all the way up to seniors and the elderly. So how does the role of primary care evolve over time and as medical needs change in a person's life?
So as the medical needs of the person change, we are there each step of the way. So when I think about in the newborn or infancy stage, we are there to help patients in terms of improving their wellness. As new parents, this is a new environment for you. So we're not just catering to the mother or the child, we're catering to the entire family, helping you to navigate breastfeeding, helping you to navigate being sleep deprived, help you with even gender roles in terms of assisting each other with those roles. You look like you had a flashback.
Sleep deprivation that's near and dear to my heart. We have a kid that's turning 2 in a couple of months, and just need, they say time heals all wounds.
Yes. And then even nutritional needs, sleep needs for you, for the baby, for the mother. And so all of that is important. Right. And then just recognizing what is normal development for your child. We're talking about growth. Are they achieving their milestones at an appropriate age? Are they actually advancing based on mother and father? We don't expect them to be very tall or very long if both parents are very short. So within context. And then 2, we have a lot of information circulating in our society. Yeah. So someone may be telling you, oh, you need to feed your baby this at this time. And so your primary care provider provides the bridge for collecting that knowledge from you related to your cultural environment and being able to apply it appropriately for you. Yeah.
I always tell people I'm happy to have a wife who's a physician because, especially in those early stages when you're talking about milestones and it's like, well, okay, so how does a milestone shift if it's this or if it's that or this is in play? And I'm glad that I've always kind of her as a reference point because it feels like there's so much information out there. And like you said, it's kind of dependent on the parameters of that particular kid. So there's a general milestone, but then it's also like, okay, so if your kid is coming from a short family, you're not necessarily going to expect them to be on the same growth chart as someone who, is coming from a family of basketball players, as an example, right? Correct. So I think it is good to have that. And this is why stuff like this is important, to kind of have that education come across so people know what to expect and what they can actually come to you or someone else who's a primary care physician for. So let's go deeper into that newborns and children's space. So you mentioned, helping the family navigate, but what other components or what other roles does primary care play when it comes to, say the first year of life for a newborn?
So in that first year of life, other than your developmental milestones, we also consider vaccinations, screening for important illnesses, such as like your anemia, that sort of stuff. And just recognizing if there's anything that's happening that's affecting the development of the child. Right. And I'm talking social aspects in terms of nutritional needs and being able to provide. We're talking about exposure to allergens, all of those things. Even being able to commute to and from your clinic in terms of access to care and early recommendation to a specialist if needed.
Yeah, understood.
But it's also not limited to just those things. You can also consider vision care and screening, hearing screening, which is important. So imagine a child that's not responding early. So mom is making smiley faces, blowing bubbles, and making sounds towards the child, and the child is not responding back. So when they have that visit at 2 months or 4 months with us, we can say, hold on, the baby is not turning their head when you're communicating with them, so they're not responding in language. What's happening? Oh, the baby's not having a normal motor function. What's happening? So we kind of identify if there's a vision issue, if there's underlying issues, or if there's a hearing problem. So early on detection.
Right, which speaks to that concept of early intervention, right? So you mentioned that a big component of the primary care space is well visits. So how do regular well child visits help in tracking developmental milestones and ensuring their overall health?
So with well visits, we have a range of things that we expect to happen at each stage. We talk about immunizations. We talk about milestones that the child should be accomplishing. We even talk about even the parents' mental space. How are you meeting the needs? How are you communicating with the child? Are you recognizing certain cognitive and behavioral issues?
Right.
Are you recognizing the emotional component of it? And just the examination to make sure that everything is normal. Sometimes you may think something is normal and it may not be normal. Maybe it be an early sign leading towards something else.
Right.
And so us being able to early identify, have the records together to be able to say, okay, this is what was happening a month ago, but now suddenly we see this change. Or suddenly we don't see this change.
Right.
That sort of intervention.
Yeah, and I think it's important to, there's so much information that's out there when you talk about that newborn space and early childhood because, your Grammy's saying one thing, your mom is saying this thing, your auntie, you this, you that, the next, the neighbor down the street. And so I think it is helpful to kind of fill and bridge that gap with information because you could kind of insert, because again, it goes back to the earlier point. It's like every kind of circumstance, yes, you have these core milestones and things that you expect, but those also shift depending on
social norms, religious beliefs.
Exactly. So it is helpful because again, even those things shift over time depending on whatever happens in life, society, where milestones end up changing, things like that change.
And even how our cultural practices affect our health.
Right.
Because imagine you're introducing food and water before it's recommended, and then the child presents with constipation, gas, and upset stomach, and you're wondering what's happening. Why is this happening to me? And then we're not realizing, okay, so we may need to shift the cultural practices even though everyone is putting in some input just to make an adjustment.
Right. That makes sense. So what are some of the most common challenges or misconceptions that, parents face when it comes to understanding primary care for their children?
So you touched on it a little bit. So the wellness timeline.
Okay.
So expecting their child to be the same as another person's child. Also knowing that there's a range. It doesn't hard and fast by one they'll be walking.
Right.
They'll be speaking. Yes, we know that there's social cues that they should be taking at those ages, but it's not hard and fast if they're not doing it at that stage.
Right.
And when I say that, I also mean that you have to recognize and give leeway for when you should intervene or when we should now make these referrals or do the screenings, further screenings in order to see if there's something going on that track.
Right.
Also just thinking about patients not being able to explain what's happening to them or even what's happening with their child. So sometimes they'll say, oh, the baby has a headache. How do you know that the child has a headache? How are they conveying this to you?
Right.
Especially if you have a toddler.
Right.
And then just meeting nutritional needs. Sometimes we feel powerless as parents because your child is a picky eater. You don't know how to get the nutrition in there. So we can sit down and come up with a plan to help you navigate that journey. So it's all part of the aspects.
Yeah, it is interesting. Like I say, I think the way cultural norms kind of intersect with healthcare because all of that has a role to play. And that's the other thing, is there, but I always like to ask, is there opportunities for even looking at, should there be like a secondary set of, whether it's goals, milestones, things that I know, like our culture is different, right? Our people are different. A lot of what we adhere to would be American standards and practices. And it's like, is there room for something that makes more sense in our cultural sense? And I guess that's where you fit in, right?
Yeah, certainly. So we do look at our population, what we see commonly and how our children develop. And so that's important for us to know that it's not going to be hard and fast what someone else's school standard is.
Right.
And we're not going to try and hold them to that narrow standard. We give a little wiggle room and make sure that there's no significant change or variation. Also, I think, which is cultural, when our children do get sick, because there are seasonal illnesses that come up, they're interacting with each other. Kids are the ultimate gift of kindness. They share everything amongst each other and even with their parents. So sometimes just advising them about basic hygiene and care to limit the duration of an illness. And the common thing we get here, people asking for antibiotics when it's not necessarily warranted. So we have to consider all of that and just being able to explain to the parent and being able to provide early follow-up if there is a need to add on antibiotics and knowing when to do that. And so having this person that you trust, that you can sit down and have these conversations with, knowing that you can contact them if you do have another follow-up question, as opposed to seeing somebody new every time.
Yeah. I mean, I think it's important there to stick a pin, if you don't mind. What is the risk of adding antibiotics, and I am thinking long term here, what is the risk of having antibiotics introduced in a situation where it may not be necessary in terms of how that may play into overall lifetime health and wellness?
So usually how I explain it to parents is, it's like me giving you a medication you don't need. So in this instance, it's not providing you with any care. And what it may actually do is cause you to get resistant to it over time. And so in our population, when you do need to use that antibiotics, it may not work for you because you've been exposed to it so many times, and then you're overusing it. And then it may have side effects that are undesired. For instance, some antibiotics can cause severe diarrhea. So you're coming in with a cough or cold that's viral that may be self-limiting, or you just need to provide supportive care. And now you're going to give the child diarrhea, which can now lead to irritation in the genital area, or rash, or discomfort. And so you're just thinking about all the side effects that could happen unnecessarily.
Because you may end up doing more harm than good. Yeah, so it's an interesting space. Sorry, it's just everybody. What I remember from my childhood was always, just get some Augmentin, right? And that was the thing. It wasn't necessarily for us as kids, but I just know, like, older family members, there was always Augmentin was in everybody's house, and you're like,
but it shouldn't be.
It shouldn't be.
That means they did not complete their previous treatment course.
Like, and as an adult, like, I'm looking, because obviously you don't understand it as a kid, but as an adult, I'm looking back at it now, and I'm like, where did I used to get it from, and why it just used to always be there? And then that's a whole other conversation.
And then even with gut health and nutrition, remember, we need some good bacteria to help us break down food. So if you're constantly on antibiotics, you're now changing how your body's going to respond to breaking down these foods and nutrition.
Yeah, so it impacts that as well. Early intervention continues to be it's a revolving conversation. Every time I talk with physicians, it's like, it's one of the core things that everybody talks about, no matter which area of medicine they're in. So how can primary care physicians support early interventions for things like, whether it be developmental delays or chronic conditions in kids?
So I think it's important to identify persons who are at risk, and you'll learn that based on talking to the person. If there was a premature birth, or if they're currently on low birth weight, if there's a lack of resources, or even lack of access to care. So you want to use those risk factors to kind of determine how we can support the patient best for their needs. And with general practice, there are more general practice physicians than specialty care, I would hope. So that makes it easier to access the care and the cost. So the parents are not worrying about the cost of the care, because now you're talking about a child that cannot come in by themselves. So now the parent has to lose work, time at work. So that's financial resources to get the care, as well as the cost of care, providing counseling and an alternative care, giving them opportunities to get interventions to meet their needs within their limitations. Supportive care, specifically with the developmental delays, a lot of times in our culture, we don't claim that. Don't tell me that my child is not hitting the milestones because I don't claim that. When in reality, we need to explain to them so they can make an informed decision on getting care for their child, which may be speech therapy, or which may be occupational therapy, or even just behavioral interventional therapy and counseling services. So we need to look at the entire approach, and then letting them know that they're not in this alone. When I refer you to a specialist, I'm not just going to throw you there and leave. Most times what we do, we write a physical referral. We ask the patient if they know where they're going. If they don't know, we can call the office of the specialist if they're within our network to make the appointment for them, even liaise with the doctor, say, hey, this is Dr. Evans-Pinder. I would like to refer my client so-and-so to you. Please feel free to call me or email me if there's anything you need help with, or if they're unable to explain anything. So you build that network between the specialist and the patient, and so they know that they're not alone.
The early intervention, I know is a critical thing too when you talk about that concept of not claiming things. Because I remember, I had a conversation with someone last year talking about autism, and that being one of their pain points was they wish that parents would just see what they're seeing for what it is and engage with healthcare earlier, because it gives you a better opportunity, particularly in the space of that conversation. And I guess it's the same thing, like you say, if you can spot something. Because it may not be that far on the spectrum. And I was
just about to say, because some people associate certain terms with the worst case scenario that they can think of. They don't realize that there may be a spectrum, that your child can fall anywhere along the spectrum, and then we can intervene to help them to actually thrive.
I mean, it's like prevention is better than cure, and early intervention is better than late intervention, right? It's like it's along the same pathway. So as we shift from younger children and into a conversation around adolescents, what are some of the unique primary care challenges that adolescents face, or that you face when you're treating adolescents? What are some of their issues?
Wow, treating adolescents, they're in a class all by themselves, because you have the parent who highly involved, wants to know what's going on, and they tell you what's going on, and then you ask the child, and it's completely, or the young adult, the adolescent, and they tell you something completely different. And so it's finding that middle ground to what's actually happening, and being able to build a rapport and trust, so that I can say to the parent, hi, mom or dad, don't get offended, I need to ask some serious questions. If you feel that you cannot sit and listen objectively, do you mind stepping out of the room? Right. And so sometimes that is necessary when we're asking questions about peer pressure. We're asking about exposure to pornography or illicit drugs. We're asking about what are some of the social things. In society, a lot of people don't take mental health seriously, or they think, well, you're a child, you don't work. What do you mean you have stress? What do you mean that you're feeling all of these emotions? What do you mean you're depressed? There was a joke on social media where a Caribbean parent said, go depress those dishes if you're depressed. Go find some work to do. That sort of thing. And so just being able to bridge so that they can both understand what they're feeling, giving them their privacy and their respect, and just letting them know we are here to help them, that this is not a judgmental zone, and that we do need to ask these questions. Because if they're not learning from us, then they're learning from someone else, and we don't know what preconceived notions that they're learning. And
you don't know what influences are happening in that space in terms of where they're learning it from. I know in that space, it does get interesting. Like you said, it's all of the interrelational dynamics between the parent and the child, the parent and school, parent and friends. I'm sorry, the kid in school, the kid and friends, that sort of thing. And then, it's also the mental health component of it. I think people don't often understand, and my wife likes to say this, she's like, children are just mini adults. So the same way that as an adult, you can be impacted by things that happen in your life. So whether it's a parent passing, whether it's, issues with your spouse, issues with finances, issues at work, all of those things, the kid just has mini versions of those, but it affects them the same way it would affect you. So the same way you might be stressed out over something like that happening, is the same way if the kid is in a family where the parents are going through a divorce, or, they've had some sort of hardship or anything along those lines, or even worse, if there's some sort of abuse or trauma that's involved, all of that plays in the same way and has the same impact on them. And a lot of times, in reality, they're a lot less equipped to face that on their own. So think about it. If we have adults who have to go and seek, whether it's therapy or even just talking with their primary care physician about what's happening in that space, imagine someone who is completely ill-equipped to deal with it, even more so as an adolescent. And I think that's a critical conversation, because yes, in our culture, Caribbean culture in general, it's just like, yeah, you go depress them. It's just like you said, like that's the space that we live in. But at the same time, I think there's so much opportunity to help our kids if we just paid attention and moved a little bit away from this idea of I'm not claiming this, or kids can't have stress, and some of the things that we just say culturally.
I definitely agree with you. And also just thinking, adults tend to mask a lot of what they're feeling. They can hide it, they can pretend to be normal, or they can be functionally normal, and then they go home and they deal with it. Right. As adolescents, they're going through so many changes all at once. They're comparing what their body's going through. How are they feeling? How are they adjusting? And just even comparing amongst themselves. This person looks like this, or how come this person has started puberty before I did? Right. And so they're dealing with all of this internally, and they need to be able to have somebody to have that conversation with, who can reassure them, who can build their confidence, let them know that everybody's going to change at their own pace, and just being able to recognize what is actually happening to them. And I think parents need to be able to open the conversation. A lot of persons were not able to have the sexual conversation with their parents. They learned by some other mode and without talking about it. You just knew that they learned about it, but nobody wanted to talk about it. And who are they learning from? They're learning from the people that they see, the relationship that they're seeing happening, and they're formulating these ideas, which may or may not be helpful to them. And so we have to be aware of all of these things that are happening. We have to ask the question. We need to open the conversation up, even about contraceptives.
Yeah. You can't have your kids learning about, sexuality from the Euphoria as a really insane example, but it can't be that's where they're getting it from is television or their friends.
I was just going to say it's not that insane because everybody has these handheld devices. They have access to the different streaming platforms. And so we have to be aware that these kids are and even with AI now, these kids are building relationships online. We have to now be able to target these things and listen to them objectively, provide information, because with the interaction, it's not the doctor telling the patient what to do. It's a partnership. We're sitting here. These are some of the things that you're concerned about. We can explain and explore them. We can come to an agreement where, okay, this is doable for you. This is not doable. We can put a timeline on it. So it's just not a blanket fix. And then we have regular follow-ups to make sure that things are actually progressing so that we know that, okay, this has been happening early on. It's now getting to a more severe stage. We need to intervene in terms of sending to a specialist early on,
Yeah. That's the thing, you mentioned it being a partnership. Once you get into adult interactions, the partnership is just between you as the physician and that one individual as a patient. But when you're talking about kids and adolescents, you're now talking about a partnership between, more so adolescents, because you're talking about young adults and they want to have their input. It's actually a partnership between up to as many as 4 people, because it's you, the physician, it's the child, and then it's both potentially mom and dad. And so that gets to be a lot more interesting because there's a lot of different viewpoints and opinions and feelings that get into the mix. You mentioned, when you get into that area of sensitive conversations and sensitive topics, how do you navigate that? So, you said in some instances you may ask the parents, if they're uncomfortable to kind of leave, have that conversation. But when you get to the point of having to discuss it with everyone that's involved, parent and child, how do you address those sensitive topics like illicit drug use, like sexuality, like things like that?
So honestly, I'm very open with the patient and I pick up on visual cues. So the interview is not just listening to what they say, but listening and looking at how they respond. So when I ask a question, I may ask the parent, I might ask the child, and I look at how they interact between each other. If I can see that the parent is making a statement that makes the child uncomfortable, or the child puts on a defensive pose, or they're averting their gaze or becoming shy and withdrawn, we know that there are some things we need to investigate a little bit further. And it takes time to build that rapport with the patient. So when you're having them from their younger straight into that young adult phase, you're kind of building that confidence level they have that they can talk to you. Because interestingly enough, patients can give consent for so many things and have body autonomy, but they aren't able to come to the clinic by themselves, these young adults. And so we have to be able to open the lines of communication with their parents, that they aren't children, that they do deserve privacy, they do deserve respect, because a parent may come and they may feel so overwhelmed, they may not realize that, listen, this is this young adult, this adolescent's private business, and they may go home and tell other members of the family. And how does that affect them? So we do need to know how to help the families maintain confidentiality, but still accomplish what they need to accomplish. And it's a safe space, because the parent may be overwhelmed hearing all of this new information that their child has been exposed to when they're thinking that they've been sheltering them all along. So sometimes it's an eye-opener for both sides.
So, how then would you, for any parent or guardian who may be listening that, is in this space of dealing with adolescent, teenage children and navigating this, how can parents, guardians best support their teens in maintaining a good relationship between the child and the primary care physician?
So what I always recommend is staying current. There's a new trend. We listen, but we don't judge. And so it gives you the opportunity to literally sit to the table with your children. It gives you an opportunity to provide a space where they can sit and talk and just be themselves with you. And you don't judge them. You just hear what they have to say objectively. So creating that openness between the two without load shedding because of your insecurities or your fears of what may happen. And just being realistic with them, letting them know that actions have consequences and thinking that you're not choosing a consequence, you really are. So just making informed decisions. So providing information. Sometimes parents don't want to have the conversation, but you can provide a handout or a video or something and then say, hey, if you have any questions, I'm here. My door is open. And genuinely be open. So when they ask you a question, don't run away. So that's how we're going to start. One time ago, it used to be abstinence. Sex does not exist. Abstinence. But what the statistics showed that's not what was happening. We had a lot of unmarried persons with children, and so we had to be realistic about that. And so clinics provide contraceptives for free. So having those conversations early, and I'm not just talking because I find that a lot of people are more open with having those conversations with their sons as opposed to their daughters.
Right.
And so we need to have these conversations. We need to teach them the values that are important. A part of primary care is not just looking at the patient. We're talking about family values, core values, making sure that the adolescent's value align with the parents' values, because sometimes they may be thinking different things, even religious values. And so we have to be aware that these do impact how they respond to things.
Right. And it's not, for our listeners, it's not to promote like underage sexual activity.
No, not at all. We don't promote it.
It's about ensuring that, you're giving information, allowing people to parents and adolescents to understand the complexity of it.
Correct.
And I think ultimately, what you're getting across is create a safe space.
Create a safe space and let them know that they're respected. I find that when you're kind of restricting people, it makes it more interesting or tempting for them to go and try or even try to figure out what it is you're talking about. So when you provide the information, they can read and say, oh, this is what happens, or this can happen. Oh, I want to avoid STDs. I want to avoid unwanted pregnancy. Oh, this is what can happen. Oh, this can be treated or this cannot be treated. So you have to give them the informed decision and know that there's not a fear of punishment or judgment or isolation.
And I think it's also knowing your kid, right? Because like certain kids may not be ready for those conversations. You kind of have to know where and when to insert that into the dialogue, because you don't want to do it too early and you don't want to do it too late.
Correct.
Right? So it's managing that sort of component of it as well.
Yes. So I guess it's whether you're having the birds and the bees conversations earlier, or if you're having a more in-depth conversation with them as they develop.
Right. Okay. So let's move into adults. What preventative health measures should adults prioritize in their regular primary care visits?
So regularly, we recommend at least one annual visit per year. During this annual visit, you'll have history taking examination, and we can discuss any concerns. So I always tell patients before your annual visit, you want to write a list of your medications that you're currently on, or even supplements that you think you may be interested in taking, so we can know how these affect your body and just have it on the record, because we need to know how drugs interact. Also knowing about vitals checking. Some people will say, oh, I'm young, I'm fit, I don't need to check. But you need to check. You may have a family history of hypertension. And hypertension is a silent killer. You may not know until an event happens. So you need to be checking this regularly. Sugar screening as well. Even screening for infections. If you're diabetic, are you regularly checking your feet and checking your skin for infections or cuts? And so making sure that those things are happening, and circulation. Are you exercising? Like the social part of it. Are you exercising to stay fit? Are you exercising for cardiovascular health? What are your nutritional needs that you're meeting? Are you anemic? Are you not getting it from your dietary supplement and we need to add? So these are the things that we need to be screening. Commonly, some of our lab testing, we check the liver, we check the kidneys, we check for infections, we check the blood count, the thyroid. Now, all of these tests are not checked every visit. Okay, so if you've had a screening and it's normal, the doctor may say, okay, or your primary care physician may say, okay, well, we'll recheck it again in 3 to 5 years. I'm talking about pap smears. If you've had 3 normal ones, we may not do them every year. We might extend it to every 2 to 3 years. We're talking about mammograms annually. Typically over here, we do them annually because of the high rate of breast cancer. But annually, you can get your screening at age 40. If you have a high family history, we start those screenings at least 10 years before the person was diagnosed. And so just even with for the men, prostate screening, and having the conversation leading up to the age where they're starting to be screened, because some people have a lot of anxiety coming in, not knowing what they're going to expect during the annual visits. And then just tailoring the visits specifically to what the patient needs. So you may be well and you just need a once a year visit. Somebody else may need twice a year screening, and those persons with comorbidities that need tighter control, they may need to come every 2 to 4 months. And so just tailoring the visits specific to what the patient requires.
Okay, understood. It's interesting that thing about appearing on the surface to be well, and there may be underlying things going on. Like I have a friend of mine who goes to the gym, travels, works out, does all of that stuff, and was on like multiple hypertension meds because when they went and checked it, they had hypertension. And so it's like, by all appearances, physical and otherwise, this person looks completely healthy. But if they weren't actively checking on their health, they wouldn't have known that they were hypertensive, and you have all kind of risks that then come into play with that. So it does speak to the importance of kind of knowing and not just assuming, hey, I go to the gym, I, eat relatively healthy, I travel, I de-stress, whatever, all of those things that come into it. But still to know for sure that there isn't something going on that you just can't see on the surface.
And so that's important when you mention that, because sometimes misdiagnosis. Some people go to Google and they may decide that this diagnosis leads to this, and that's completely wrong. Or they may have to see it in a context. Mm-hmm. Someone may be having headaches and they're just, I have migraines. They assume. And I always ask, who diagnosed you with migraines?
Right.
Or, my mommy said it. Or, I read about it and I think my symptoms match the profile. So you have to be very aware of these sort of things, because migraines are not the only type of headaches. Reminding patients that they're, we're getting the symptoms and in context. You may have sinus issues. You might be dehydrated, So it's just really delving into what's actually going on and helping them in a better environment.
Yeah, so sometimes your migraine, you just need to clean up the extra dust that's in your house because your sinus flared up and now you have a migraine, and it's as simple as that. This reminds me, there's a song where, I can't remember who it was. They said, I have a headache and it's not a tumor, because that's like we go sometimes so intense, because we do the Google or we do the WebMD or we do the TikTok, and then there's just this litany of information. And I think it speaks to the importance of education and correcting the potential misinformation by engaging with an actual healthcare provider.
Yes, and even now with us having come out of a pandemic, the conversation around vaccination in children and adults is back on the rise. Before, a lot of times adults would go missing after they've gotten their last set of immunization in childhood. You may see them if they had an injury and they needed an update. But going to your primary care provider ensures that you have the conversation on what vaccines you need to be updated on.
Right.
Are you getting your seasonal flu vaccine? Did you get your tetanus vaccine every 10 years? That sort of stuff. If you're a person who's traveling regularly, are you prepared for the travel that you're about to take? Because some vaccines require 8 weeks in between or 6 months in between. So you need to be prepared. You don't want to be caught off guard. And even prophylaxis if you're traveling to some areas.
Yeah, so there's a lot to consider. Obviously, I think for a lot of people, when they think about primary care, they think about the management of chronic disease. So what role do you play in helping adults manage their chronic diseases like hypertension or diabetes, things like that?
Well, I always tell my patients, and it's so funny because I'm also guilty of it. When you ask them, how's your diet? And they say, I have a good diet. And I said, okay, that's interesting. Define what you call a good diet. And they say, my doc, the regular stuff. And they call up all the juicy Bahamian foods. And I sit down and I write it out. And I said, let's go through it. I said, let's take it step by step. What did you have for breakfast yesterday? What did you have for lunch? What did you have for dinner? And I said, okay, so let's analyze that. Did you really, let's be honest, did we really have a good diet today? Did we have all of the food groups represented? What is your nutritional value and some of these things you're taking in? And then two, it helps the patient to be accountable.
Yeah.
And I bring up nutrition first because a lot of these diseases are lifestyle diseases. Yes, they can be triggered or you may have a genetic disposition for it, but a lot of it is lifestyle, obesity. And that is a very common one here. When I say to the patient, you're overweight or you're obese, let's get on a track to try. And I always use myself as a reference. I said, I'm also trying to lose that extra 10 to 20 pounds to help me get in shape. And these are the ways that I'm also doing it. So you're not on this alone.
Right.
Sometimes you build that rapport with the patient when my patient will say, Doc, if I come and see you in 6 months and you want to lose your 10 pounds, then me and you got to have a conversation. And so we build we build those sort of rapport. And it's being honest and open with the patient so that you can help them.
Yeah.
Persons with diabetes, making sure that they're compliant on their medication. Making sure that they are actually being secure in the things that they're doing.
Yeah.
We like to groom ourselves. We want to get our nails done. We want to get manicures and pedicures. They have to make sure that they are clipping their nails appropriately. They're not putting their feet in extremely hot water and causing any burns or bruises. Right. And so it's just making sure that the little things that you may not think about on a day-to-day are actually being targeted. And so that's why having that conversation open the door. Even hypertension. Think about it. We love our food very, very salty or highly seasoned. And sometimes the patient will say, Doc, man, I really season that like that. I said, so what was in it? And when they start telling you about the salt beef and the this and the seasonal, exactly. And I'm like, okay, so maybe we can sit down, and if we cannot come up with a nutritional value for you, we can refer you to the nutritionist.
Right.
And so sitting down and actually cultivating a plan that's specific. And what I love about primary care, you allocate the time to have these conversations with the patient. They're not feeling pressured or stressed And they can actually ask about other questions related to the management of their chronic illnesses.
Yeah.
Even when we think about asthma, being able to have the conversation with your patient, because sometimes people forget, I had asthma in childhood. You still have to be aware. Do you have a pump in the case of an emergency? When their Sahara dust is moving, when there's lots of smoke in the environment, are you at risk for getting an acute episode? Yeah. So it's always having those conversations so the patient can be well prepared, even if they've been unaffected for a very long time.
Okay. The lifestyle changes one is a big one. Like I know we had a recent episode a couple of weeks ago with a friend of mine, Angelo, who went from 440 pounds, hypertensive, pre-diabetic. He went through major lifestyle change. He changed his eating habits. He got religiously into the gym. And now he's down to 200 pounds and he's off of, the medications that he was on. And so it does speak to, how important that is in the overall management of health. Because I think people don't often realize that, you don't necessarily have to be, diabetic or hypertensive when you kind of look at making those sorts of adjustments. Like there's an opportunity to get off of medications.
Correct.
So we have challenges with people actually adhering to medications as it stands. So why not just put yourself in a position not have to be on them, right?
And then medications. With medications too, you have to remember the patients are watching TV. They see people, they don't have to exercise. They can use this specific drug to lose weight rapidly. And so I have the conversation. Yes, there are some people who require that medication to assist them with weight loss. But what happens when you come off? Are you trading one lifetime medication for another?
Right.
You have to make those informed decisions and maintenance. I always tell them, if you get it off rapidly, you lose the weight rapidly, it will come back on rapidly. So slow and steady wins the race, and we're there to hold your hand every step of the way.
Yeah, that's awesome. So let's move on to talking about our seniors, our parents, grandparents. What role does primary care play in that age bracket?
I think this is one of the more exciting periods because we've seen these patients go from childhood, adulthood, now into their older or later years in life. They've gone through midlife crisis, they've gone through retirement, they're going through hormonal changes and balances. So it's just finding what is best for them in their segment. And I love asking them, now that you're retired, what is it that you're planning on doing? And sometimes I sit back and I listen. I'm like, okay, great plan. So the reason why I'm asking is not just to be invasive, it's to help you formulate how to keep you active, mentally and physically. Because if you're home sitting on the shelf, you don't use it, you lose it. And so we have to always remember that even though the population is getting older, we still need them to be very active. And we find that younger family members need to get involved because memory issues become a factor. Dementia becomes a factor. Fall risks become a factor. Compliance on medications become a factor. And just being able for them to operate within their home under conditions that are helpful to themselves as well as for other persons as well. Particularly in the older persons, just helping them to transition. I call it a transition of care. Once a man, twice a child. And so being able to live to see the point where you require your children to help you or require a caregiver if you don't have children to help you. And making sure that what you've invested into your body in your youth now gives you the most benefits. Now as you're older, so taking your calcium supplements. We're talking about joint pains and aches. We're talking about activity levels and stretching regularly. It's almost like I use the example all the time with patients. If you're not exercising or even stretching, it doesn't have to be a high intensity workout. It's like the door. Have you ever seen a brand new home that's not in use? The doors are not opening or closing. When you go there, the door is creaky and rinkety. You have to nudge it a certain type of way. Our bodies are no different. We have to be using that hinge, moving those joints. And a lot of them will tell you, now that I'm being more active, the pains aren't as bad, I can work through it or I push through it. And then using the medications that's specific for that age group, because we're not going to damage your kidneys in your 70s.
No.
And your 80s. We're not going to overload you with fluids.
Because the nature of care changes as well.
Of course it does. And then thinking about what are they most at risk for. Imagine in your childhood, you would have had chicken pox, and now suddenly you're thinking that's over and dealt with. And now you're past the age of 50, you're past the age of 65, and now you develop this new rash that's on fire. So now we have to have that conversation about shingles. And so just knowing what happens at different phases of their life and being able to have the conversation with the patient so that we can provide adequate care for them. And even the big word that nobody likes to hear, when you think about cancers, you think about being older in age. If we all live long enough, we may approach some sort of cancer. And so being able to help people navigate through these changes and what's the appropriate care for them. If you're 92 years old, what are some of the things we're screening for? What was life expectancy after that?
Yeah, it's like I don't know if you're doing chemo or radiation at 92.
Exactly. And so and that's not just for the patient, it's for the family, because sometimes it's difficult. You want to do everything you can or whatever life and saving intervention for your family. And so even the conversation that a lot of people are not ready to have, advanced directives. What if I'm not in the state of mind to decide for myself? Is my family equipped to decide for me?
And that's the thing, we have a conversation coming up soon with someone in critical care where that's going to be a whole segment of conversation is navigating advanced directives, because that gets to be, I've had both of my parents pass from cancer in the past few years, and that conversation around how you navigate that and what you do and what you don't do is a very interesting one. So yeah, I think that when you start to think about it, especially for the younger family members who are involved in navigating the care for, whether it's their parents or their grandparents, that becomes a necessary conversation, because you have to know how you want to collectively as a family navigate these things. And sometimes it's about what gives Grammy or, Granddaddy the best quality of life. Is it running them in and out of tests and procedures and things like that, or is it just, hey, let's just spend as much time with
together,
them, that we have left outside of hospital, outside of the clinic, and just kind of focus on quality time.
Correct.
Yeah,
very much so.
So I know one of the things that becomes an interesting thing to navigate with the older adults in our life is coordinating care when there's a lot of different specialists involved. So how do you, as a primary care physician, assist in navigating that? Because I know that can get a little bit much when you're talking about, especially if you're talking about something where if you have surgery involved, if you have, medicine, oncology, when you're talking about cancer, that space, how do you fit into navigating? How do people coordinate that?
Okay, so the primary care, as we talked about, being that bridge, it's important that when you select your primary care provider that you understand that physicians operate in a network. So is your physician connected to other physicians who they have access to, or are they just giving you a blanket referral and say, go find a doctor? So you're now having to kind of doctor shop without having any knowledge of how to interact with the doctors or who you're interacting, or if you're going to have direct communication with the doctors. So being within a network makes it easier to say, okay, let me call the surgeon and ask what's going on with your care. Let me inform the surgeon that you may forget to bring this, or you may forget to do that, or you're not in the mental space to remember and you don't have an awareness that you're not remembering, so he or she needs to talk to your daughter or your aunt or tell you to bring a notebook. And so we need to be able to have those networks to coordinate the care, and just knowing that the results will be in the same place. Being able to access the results, you can say when you send them, you can say to them, these are the copy of your results or your scans, so that the surgeon is going to ask for, or any specialist. I'm just picking on that as an example. And knowing that at the end of the care, I'm not just throwing you to the side. I'm going to ask for a follow-up visit. Can you come back to me afterward? I'm going to call you. Hey, how did that visit go? And that comes with building rapport. Sometimes patients who have not experienced it before, they say, hold on, the doctor called me to find out how did the follow-up care go. And sometimes I may even call the specialist, hey, I was expecting the patient back in 4 months, and I haven't seen them back. Is your treatment course going longer than expected? Is there something I need to be on board with? How can I help? And so that's what helps with being within a network of physicians.
Yeah, and you mentioned building relationships and trust, that rapport, and I guess how it speaks to even the continuity of care, right? So, how important is that, the continuity of care, especially when you're talking about long-term health and the outcomes of, when people get into acute or chronic illness spaces?
Continuity of care is very important because patients may not always remember what happened to them. They'll say, oh, I had a procedure done a long time ago. But you, as a primary care provider, you have all the notes in one place. You can follow the patient no matter where they are. And this comes in, and I love this particularly in the Bahamas because we're not just Nassau or New Providence. We have patients that migrate all over the islands for work and for different phases of their life. And so being able to follow them and to make sure that they're having access access to care, and to make sure that they are following up on their medications, or even adjusting the notes if they had seen another physician and the notes and their medications had to be adjusted.
Yeah, because God knows people could be poor historians.
And sometimes patients doctor shop. So let's say you have, they visited some other doctor, they gave them one medication, they wanted a second opinion, so they went to another doctor. So they may not say to the new doctor that, hey, I have this medication and this is what I'm taking. Mm-hmm. So you get another set of medication which may be in the same class, that they should not be taking at the same time. And so having a primary care provider can avoid all of that. So even if you're seeing within a network, during the urgent care, the urgent care refers you back to your primary care doctor within 3 to 7 days. You can now say, okay, this is what you're currently taking. This is what management you're on from urgent care. We expect you to be on this course for X amount of time, and this is how we need to adjust your treatment plans. And so having that helps with the longevity of the patient overall.
You mentioned this concept of doctor shopping. What advice would you give to someone who's searching for the right primary care physician for them or their family?
So I always recommend certain factors when looking for your primary care. Your preferences matter. It's not just sitting in front of anyone. Are you more comfortable being open and honest with a male or a female? That's important. Are you more comfortable with a certain age group of a physician? That's important. Do you prefer a physician who has flexible office hours? Do you prefer a physician who is more young in terms of they're technically savvy? You can reach them via email, you can call them on WhatsApp, you can do a telehealth conference. You need to select a physician that meets your needs, and then someone you can trust. If you come into the consultation and you feel uncomfortable, they're not open, it's very didactic or it's very one-sided, you need to be able to say to them, hey, I feel a bit uncomfortable. Is there some place how we can adjust? And just even being able to build trust with the patient. A lot of times when my patient comes in, I don't initially just start asking them. It's not an interview. What is this? What is that? What is that? I'll be like, hey, how are you doing? I'm Dr. Evans-Pinder. How was your holiday? What did you do? Everything was good? Okay, so what's the purpose for your visit today? And so that might be the first interaction they had with me, and then I find that they will come back. And so you need to be able to have that rapport with the patient. You need to be able to be open. And sometimes patients ask you, hey, doc, how was your holiday? And I would say, my holiday was really good. But I will be honest with you, it wasn't really a holiday because I have 3 toddlers. So you have to have that line of communication open, and being able to build the trust so they know that you understand them. If my patient comes to complain about a certain aspect, they know that I have the skill and that expertise. And to be honest with you, because if I don't know something, I don't claim to know the end of all things. I will say to them, listen, I'm not familiar with that medication. Do you mind if I just write it down or show me the box? I can look it up. I will call the pharmacy and I will ask the pharmacy about it. So I'm going to find the best response for you, and I will get back to you. And so patients prefer someone who's going to actually follow up with them and be honest to say, well, listen, I think this is beyond the scope of what we can provide you here in primary care. However, John Doe is an excellent physician who I think can more channel your needs, but I'm still here as a reference point if you need me. I think they prefer that as opposed to you coming every day and not giving them anything new, and they're feeling helpless.
Because then that's how people get frustrated within the health institution, the health industry, and end up sometimes lost.
And then doctor shopping can also help. Does not help if the physician is not explaining properly to patients. Because I've had patients come to me and say, doc, this is what I'm taking for this symptom. And I said, but you're on the correct medication. Well, I didn't feel comfortable because the doctor just gave me that and tell me take it. So essentially that visit is for counseling services, and they want you to explain the medication. What does the medication do? How does it affect me? Does it have side effects? So that's important that when we're having these primary care interactions to explain to them, listen, I'm putting you on this medication. A side effect may be drowsiness. So I don't want you to drive. Are you able to take time off? Do you need the coverage? That sort of stuff. How does that affect the patient overall? Do they have responsibilities where they can't function if they're drowsy? Do we need to find another medication? Do we need to reduce the dose so that they have a lower side effect panel? And patients prefer if you're honest and open about these things.
Because then it develops trust, right? They know that whatever you tell them is going to be truthful and honest, and it makes that whole interaction a lot easier. And I think we're in a time where we need to, reestablish trust in the healthcare industry as much as possible, because people are, anecdotally, it seems like more people are getting sick, and then people are getting sicker. And so, it's also at a point where there's a lot of mistrust and distrust of the space. So I think it's important to have conversations like these to help people understand that, you have people who are in the institution in the industry that are, really interested in helping people be healthier and be well. And I think especially in the space of primary care, that's a large chunk of what you're trying to do. It's like that whole thing of whether you're a baby or you're a family with a baby, or, you're someone who's elderly, or you're helping your parents or your grandparents, that that there's a space that's safe to kind of come and have those conversations, and someone who is actually trying to help you take care of you and your family.
Correct. And just access to care.
Yeah.
Are you booking a physician that you can't see till next month? Is your physician open to a telephone call?
Right.
Is your physician available after hours? Just all of these things, or even not just your primary care physician, but your network or your facility.
As
Are
well.
they able to accommodate you?
Right.
If an emergency or an urgent thing happens. And so just being able to put all those factors in, because realistically, social factors matter. Location matters, accessing healthcare matters, and just your social determinants of how you can actually progress.
So, I want to wrap up with a question in the space of the future of primary care. Because I think we touched on some of these things as we've gone through the conversation. But what trends or advancements in primary care are you most excited about for the future as we wrap up our conversation?
Well, I'm a millennial, so I'm excited for all the digital advancements.
Right.
So particularly telehealth. I like the fact that I can communicate with my patients over whatever platform that allows me to either telephone them, send a message, or even video call them, conference them. And that's in real time. So I can see them, we can interact, even if they cannot get into my office right away. So that reassures the patient that we can have that communication, and then they can still book the appointment to follow up. And then I notice with my elderly patients, they definitely do not like telehealth. I may call to give an update or check on them, and they will still come in and say, Doc, I know you called me on the phone, but I want to see you face to face and ask you and get a feel of what's going on. So even though I love the digital platforms and the new devices, you can put on a patch. I don't want to call it a specific name to monitor your sugar. So I could take away the guesswork. Is this person writing a true value versus an actual monitored value?
Right.
Empowering the patients to actually use a blood pressure monitor. Everybody's wearing smartwatches now. I can actually pull up you can give me access and I can pull up your data and we can track it together. So it's almost like digital health is empowering people on every level.
Yeah, to take better care of themselves. Yeah, I think that the future of it as it pertains to technology and all of that is definitely exciting. I think the funny thing that I always think about when it comes to, like you said, you might have an elderly patient who you have the phone call with them and they come, because sometimes the doctor's office is just a visit. It's a way to get out of the house. It's the outing. It's an outing. It's exactly that. So yeah, I think it speaks to just the variance that exists in the space. And I think hearing someone like yourself talk about, your approach to it, being able to navigate both sides of that is helpful, because, you're able to navigate for those who want to be super into tech, but also those who may just want to be like, well, Doc, I just want to come and sit down and see you face to face and have the conversation.
Correct.
And I think that's important for people to know as well, because then no matter which age range you are on the spectrum of life, you can feel comfortable coming into the space and dealing with whatever health matter it is that you want to address.
Absolutely.
So I want to thank you so much for taking time out of your busy schedule. This has been an amazing conversation. I know you probably have patients waiting, but I would like to thank you for your time. This has been good. I think it's going to be very helpful for people to kind of understand a little bit better where primary care fits in the overall health institution, and hopefully it'll encourage people to, say, well, I don't have one, let me reach out. So if someone is in search of a primary care physician and they wanted to book an appointment with you or give you a call, how do they get in contact with you? So
I'm currently located at the Oak Tree Medical Center, at the main location, which is in Palmdale, which is off Rosetta Street. The telephone number that you can reach us here is 322-1145. So that's 322-1145. And our reception desk, they're more than equipped to help you with making an appointment, answering your general questions about how do you book to see a primary care, and even choosing a primary care. We do have a selection of primary care providers. Right. Or you can send me an email and I can help you navigate it on a one-on-one basis. Okay. So my email address is Dr. Evans-Pinder at Oak Tree Medical Center, and that center spells with a CENTER. And so I usually do answer very regularly. Okay, awesome. So thank you so much. Thank you. And I want to thank you, our listening audience, for joining us on this episode of Vital Voices.
Again, a big thank you to Dr. Reonda Evans-Pinder for her valuable insights on the role of primary care in promoting health and wellness across the lifespan. Remember, primary care isn't just about treating illness, it's about prevention, building relationships, and ensuring personalized care for every stage of life. If you found today's discussion helpful, don't forget to subscribe and share this episode with someone who could benefit from it. You can follow us on Facebook and YouTube for more updates. And until next time, stay healthy, stay informed, and as always, take care of yourself and each other.
Listen up. Vital Voices Podcast has an amazing giveaway just for you. Want to treat yourself to the ultimate relaxation? Subscribe to the Vital Voices Podcast on YouTube between January 20th and January 31st, 2025, and you will automatically be entered into a raffle to win an 80-minute deep tissue massage courtesy of Tranquilitas Day Spa. Imagine melting away stress and tension with this luxurious experience. It could be yours for free. Don't miss out. Subscribe today and tune into our show on February 3rd to see if you're the lucky winner. Relaxation is just a click away. Subscribe now and good luck.
We'd like to give a special thank you to today's sponsors: Oaktree Medical Center, Colina Insurance Limited, Valor Security Limited, Crown Locksmith Services, Tranquilitas Day Spa, and Jan RG Nation.